Hi there, Dr. Sassy here at the Continence Center at Sassy Surgical. You may be noticing in the new year of 2021 that all seniors are being asked some additional questions about urinary incontinence and bladder control in regular annual visits or wellness visits with primary care providers. This is not a big coincidence, and the reason that's happening is because greater attention is being placed on the problem of bladder incontinence and bladder and bowel control. The most recent mandate really comes right from the top. It comes from CMS, which is the national governing body for Medicare and Medicaid. It's the Center for Medicare and Medicaid Services. And this is a new requirement for all of the primary care physicians who participate in the accountable care organizations that CMS engages with. And there's reasons for it also, and those reasons are the recognition that having bladder incontinence and bowel and bladder control problems can be and progress to being a really devastating problem with serious impact on the quality of life of our seniors, and that it is being far too neglected as a health problem. Clearly here at the Continence Center, we see this every day, day in and day out, and we're very gratified to know that now CMS is more fully behind treating the problem by requiring that the primary care provider community ask more about the problem and understand the degree to which it's affecting every senior. For most seniors, this is a problem that begins at some point. Oftentimes there is a trigger. For men, sometimes it may be some prostate treatment. Sometimes it may have been some spine surgery or some other trauma. For women, it may have been childbirth many years earlier. But also for millions of people, there really is no one event. But at some point, with a few years of aging, the neuromuscular function of the pelvic floor deteriorates just below that threshold where the normal control and continence can be maintained. And so it begins kind of small. There may be a little bit of leakage, there may be a little bit of spotting. It may be time to wear a liner or progress to a pad or eventually to wearing a diaper. But at some point, it becomes a problem that is causing someone to get up at night multiple times and interfering with sleep, which is a dreadful problem to have over the course of time. And it begins to interfere with one's ability to just engage in life and go out and do social activities and spend quality time with friends and family and do those activities that make life wonderful. So the fact that CMS is now behind this really means that many, many more primary care providers will be asking and learning more about how that's affecting people. We know from other studies that very few primary care providers previously have been asking about it at all, and there's a very low awareness among the medical community about the treatments for it and how much it's impacting people's lives. And I would go one step further and say people are extremely ignorant of and have very little knowledge about the very high quality, high effectiveness and non-invasive treatments that have emerged over the last 20 years. As you probably know, if you've watched other podcasts of ours or read any of our literature, my colorectal fellowship training was done at a great center in Boston where there was an excellent lab center working on pelvic floor neuromuscular physiology, kind of the basic building blocks for what soon became neuromuscular intervention with sacral neuromodulation years later. And that has just continued to evolve and become increasingly effective. The devices have been miniaturized down to very small devices. And so now with a very small, non-invasive 25-minute procedure that doesn't need general anesthesia, a senior can walk out of the center with 2 Band-Aids and no longer having bowel and bladder leakage. What a revolution. So I hope you'll agree that the new guidelines and the new CMS requirement that all wellness visits and all primary care annual visits involve understanding how much bladder leakage or bladder problems are affecting the person, and we hope this will lead to greater awareness of the excellent solutions that are now available today. And with that, I look forward to a better and brighter new year, and I wish you all the best.